5 sentences, friends. We are not going to fundraise, social service, or charity our way out of this. Number 2, the question is then, do we have the courage to consistently disrupt? Getting small and fiercely local for big impact and scale. This calls for a broad collaborative network of care, the likes our sector has never assembled. And number 5, an emotion, commotion, and motion tilting to social justice. Now, depending on your answer to our first test poll, you might remember a few of these, or you might just be wondering, what the hell is he talking about now? The titles of our past 5 AGM keynotes in order from 2016. Now, let me read them again together. We're not going to fundraise, social service, or charity our way out of this. The question is then, do we have the courage to consistently disrupt, getting small and fiercely local for big impact and scale? This calls for a broad collaborative network of care, the likes our sector has never assembled, an emotion, commotion, and motion tilting to social justice. It's almost as if our entire 65-year history leads to this. Thanks to each of you, us, here, now. Now, after the year that has demanded action and some expletives too. Now, as summer days spread hope that a vaccine may help end the health pandemic, but no vaccine for the poverty and inequality that lie at its roots. Now, as Dr. Kwame Mackenzie, CEO of Wellesley Institute, states, COVID-19 has unequivocally discriminated against racialized, indigenous, low-income, and precarious populations in the GTA. Now, this once Takranto of Anishinaabe, Mississaugas, and Haudenosaunee peoples in this dish with one spoon territory is but one GTA map. The GTA COVID hotspot map is the exact same as the sticky and stubborn poverty by postal code map, is the exact same as the highest number racialized communities per capita map, is the exact same as underhouse and precariously employed frontline workers map, is the exact same as the highest number of emergency, chronic disease, and mortality visits per capita map. You get it. And Radhika lives it. Her whole life in Brampton. Her dad worked at a factory in Woodbridge, tested positive after their first outbreak in December, admitted to Brampton Hospital in days, transferred to South Lake in Newmarket in weeks, dead alone in a month. She experienced all the community's inequities just like that, she says. A health and social service sector stretched way too thin before the pandemic, now poised to snap. No rapid testing or pop-ups at times when shift workers like her dad could actually pop in. No paid sick day program. So for the first time in her life, the first time, Radhika stepped differently and deeply into community, joined residents, faith, associations, agencies, labor, all, responding the only way we know how, helping each other. Places of worship and cultural centers became food banks and 24-hour hotlines. Among the hundreds of new partners who received emergency funding from United Way last year, grassroots associations and equity-seeking groups working with United Way-funded trustees took to Facebook, WhatsApp, radio programs, reaching out to those we couldn't otherwise. United Way-funded agencies hired, trained local residents as ambassadors knocking on every neighborhood door, visiting every open local shop, getting people to pop up testing, and then to vaccine clinics. United Way funded coalitions advocating for essential workers, meeting with governments on the urgent need for paid sick leave and emergency leave. A broad collaborative of care to meet urgent human needs and improve social conditions, the likes our sector has never assembled. Because every problem here in Brampton is systemic and structural, Radhika says. And the onus is on us to take action now, at the speed of community. And that means working deeply and differently with community. Friends, the very collective energy and courage that placed equity at the center of our pandemic response in Brampton, North Etobicoke, Newmarket, Scarborough, the collective energy that harnessed our philanthropy and charity, our partnerships and policy work on the arc of social justice must now sustain and strengthen the recovery ahead. And that means acting now, even more intentionally and precisely, right at the intersection of poverty, place, and equity. And I know we have been addressing inequities at United Way for decades. Our network of agencies, programs, and partnerships, our research, giving language to poverty by postal code, income inequality, precarious employment. But if we believe, and even more, after 2020, if the data and trends suggest, say, scream that inequality is the defining and deepening challenge of our time, then equity must be the cornerstone of our United Way mission to meet urgent human needs and improve social conditions. Then fighting local poverty must be inextricably linked to addressing the root causes and structural barriers that hold far too many back. This is why we are explicitly committing to equity and reconciliation, acknowledging that individuals, groups, neighborhoods in our GTA face systemic discrimination and barriers from colonialism, racism, and other intersecting oppressions. This is why we are stating that racism is systemic, past, and present, embedded in culture, policies, practices that appear neutral but privilege some. A white, male, settler in the CEO seat like me, and disadvantage so many others. Why over this past year, as Andrew mentioned, from our board to committees, staff to community members, we have been learning, shaping, and today sharing our still evolving, raw, and in real time equity and reconciliation action plan, a vision statement, principles, and deliverables going forward. And our commitment begins with our still draft equity and reconciliation vision statement now on your screen. Communities where people's unique voice, identities, and experiences are celebrated, valued, and protected. Where Indigenous sovereignty is honored, and where all have resources and social capital to ensure their well-being and prosperity. An inclusive cornerstone for our work, not for, but by, and with community. An equity and reconciliation vision that, as our principles frame on this next slide, explicitly name discrimination and the systemic conditions that lead to inequality. Principles that ask us to be authentic, comfortable in learning, seeking input, like sharing this so early with so many this morning. Principles that seek to share power in who makes our policy decisions, who helps decide agency and program allocations, making space for people with lived experience, living the practice of nothing about us without us. Now, broadening our community advisory councils in the Black, South Asian, Chinese communities right across the GTA, and collaborating with elders, leaders on the formation of an Indigenous Partners Council this fall. And behind these principles, 7 equity levers with our staff and volunteers, making each one of them practical actions, deliverables, starting with our own internal culture, and then pushing out to every aspect of our work: advocacy, communications, fundraising, disaggregated data collection, ensuring, as you heard, for example, that our board, committees, campaign cabinet all meet the 50-30 challenge as a starting baseline, that our own talent management processes enable all our employees, including those who experience the greatest barriers, to reach their full potential. And today, with Radhika's onus on us to take action now, even more intentionally and precisely, right at the intersection of poverty, place, and equity, at the speed of community. And that means working deeper, differently with community. Our deeper and differently begins with the announcement of an incredibly generous $2.6 million investment from the Barrett Family Foundation. A transformative 3-year gift to establish the Barrett Building Opportunities Greater Toronto Fund, enabling United Way to scale multi-year support and flexible funding to organizations and programs led by, focused on, and serving Indigenous, Black, and other racialized populations impacted by poverty. And while the Foundation's Bob Barrett and Francine Rouleau Barrett were unable to join us today, please join me in celebrating, cheering, clapping, whatever we do virtually, for family members Rebecca Barrett and Kim Barrett McKenna, who I understand are here with us. Thank you, Barrett Family Foundation. Because, friends, as we strengthen with this gift the long-term core capacity and connectivity of by, for, and with equity-seeking agencies and programs, I'm also pleased to announce COVID-19 emergency funding. Details and applications will be available tomorrow, because I know some of you will already be emailing before I even finish this sentence. One-time, in-year seed funds open to little and big, grassroots and established, new and current United Way funded, nonprofit and charity, any and all. So we can go deeper to meet the emergency needs of what will be a slow summer and fall recovery for far too many. And just when you thought we were done, building on the innovation and success of our sector collaboratives over the past year, working together to solve in a united way, we will also be opening partnership and system grants this summer, funding to support co-designed emergency and recovery collaboratives, where United Way Greater Toronto is already working in partnership with clusters, tables, and local governments. And finally, this is the last, I promise, our community services program stream to be launched in the fall, an open, accessible application and selection process for 3-year funding of a broad range of high impact programs. These now, just the beginning to bring our ever-evolving equity and reconciliation action plan to life, going deeper and differently into community, into a network of agencies that will make equity and reconciliation a strategic and operational priority. With equity and reconciliation embedded in each step of our own United Way grant-making process, who we outreach to and how, ensuring accessible opportunities for groups who have never received United Way funding before, targeting more investments in agencies led by, focused on, and serving equity-seeking groups, and slowly increasing equitable access to services across Peel, Toronto, and into York Region too. Now, 6 sentences. We're not going to fundraise, social service, or charity our way out of this. The question is then, do we have the courage to consistently disrupt, getting small and fiercely local for big impact and scale? This calls for a broad collaborative network of care the likes our sector is only beginning to assemble, an emotion, commotion, and motion that tilts to social justice. The onus is on us to take action now, even more intentionally and precisely, right at the intersection of poverty, place, and equity, building trust at the speed of community, and working deeply and differently with community, always with and thanks to each and every one of you. Thank you, friends.